Chris, we were talking a little bit about healthcare. Obviously, the big discussion that happened between Prime Minister Trudeau and the premiers, Federal-Provincial-Territorial meeting. Not usually, those are fairly rare these days. They used to be less rare in federal-provincial relations. So this was a bit of a big deal. Uh, did you get a sense that there was finally some discussion about long range issues with the healthcare system? Is that something that you took out of those discussions?
First of all, let me say I am not a healthcare specialist
Right.
or even a health policy specialist. But look, my reading of the coverage of what has happened over the past few weeks, and in particular over the past couple of days, uh, I think it looks frankly not very long term. I mean, you can come up with an agreement to give more funding for the feds to give more funding to the provinces over 10 years. And you can even have some strings attached to that. And I think the strings ended up being largely about the collection of information, which is, I think, a good thing. But I don't think, at least to me, it didn't look like we are really pushing for fundamental change in the healthcare system. And
Right.
again, not as a healthcare specialist, my sense is that if we are simply going to spend more money, we will solve some problems, but I don't think we will solve some of the fundamental problems. And it's if you're going to have a system of more or less universal health care where some level of government stands ready to provide health care to all members of the population. And by the way, I should say, I think that's a good idea, but it matters how you design that. And you have to be careful about what is driving the long lineups or the shortage of particular types of physicians or the operation of the emergency rooms and primary care, long-term care. All of this is in our healthcare system. And my sense, again, just as an economist and as a policy wonk, but not as a healthcare specialist, my sense is that the problems in our healthcare system require more than just more money. I think more money is good, but it's probably not going to be enough. And I'm not sure that we're really having those conversations yet.
I would agree with you. As a former health minister, I remember having those conversations in the last cycle. So I think we've got a lot more to do in terms of innovation there. Let's turn to, I guess, the third thing that you mentioned, which was zero carbon emissions and getting to a zero carbon world. How does that factor into budget making?
So the federal government has taken a pretty clear position on getting to net zero by 2050. And I think, I take climate change very seriously, and I think that's probably a good idea to take it seriously and to try to get to net zero by something like 2050. They've also got at the core of their policy for climate, they've got a carbon price that is, in many provinces, it's a provincially designed carbon price, but it's to sort of federal standards. And in some provinces, it's a federal carbon price. But in any event, that carbon price is now across the country, and that carbon price is going to rise to about $170 per ton of emissions by 2030. That carbon price will I think, be responsible for a large amount of the emissions reductions that the federal government is trying to get by 2030 across the country. But it's not going to get us everywhere by 2030 that we want to get, and it's not going to get us all the way to the 2050 targets. So the government is thinking now about policies beyond the carbon price, and they've introduced some, and I have no doubt that they will be introducing others. And that's really where what my column is addressing is that I'm actually a fan of a carbon price approach, but I also recognize that a carbon price can't do everything. But then you start thinking about what other kind of policies you need to introduce. And I think we are going to be in a world over the next 20 years where the federal government is going to be using public investment to develop some of the new technologies that we're going to need. Some of that will be purely public investment. Some of it will be probably public-private partnerships.
Right.
Some of it will be policies to incentivize private investment. So I think we're now very much at the beginning of a bunch of policies on the investment side, again, public, private, or PPPs, that are going to be driving the clean investment that we need and to drive the energy transition that I think we're going to want to see and need over the next 20 or 30 years. And I think that's going to be expensive is really the key point. And so it's very hard to figure out exactly how expensive that's going to be because we haven't really started doing it. But I think it's probably measured in the tens of billions of dollars over the next 10 or 20 years. So that's just a big item. If we bundle it all together, that's just going to be a big item that's going to cost the federal government some money. So we should be thinking about that.